Hi, I'm Dr. Niloufar Rezakhani, and today I would like to talk to you about a little bit what is a TMJ disorder. TMJ disorder is basically, I would like to show you guys what the TMJ is. We have our head with the mandible, that is the only moving area of the head. This part of the bone is connected by two joints that we call it condyle of the mandible, and there is a disc that's sitting on the maxillary process. So TMJ disorder comes with different shape and form. Usually we have pain, we have clicking of the area, and this pain and clicking doesn't stay in this area localized. It will transfer to the C1 and C2 and the whole spine that is down here. It will transfer and cause problem with the tongue position, and it will cause a lot of headache, migraine, or tension headaches. So what we do for the TMJ, we take a CT scan, we look at the position of the condyle and position of the lower jaw, and every patient is different. So we can treat them with a very simple device, we call it NTI, or we can treat them with the whole orthotic on the lower jaw and put the mandible in the more physical biofunctional position, so to take away from all those malfunction that comes with the wrong position of the mandible and the malocclusion, and after that we can treat the patient with their teeth. So TMJ, it will come, the problem of the TMJ comes from the malposition of the lower jaw, but we don't immediately go to the teeth because the problem is somewhere else. And we have to really have the knowledge and education, how to educate the patient about what TMJ is and how we can help them. Depending to their goal, depending to their budget, we can help them with a simple device that is not pricey, or something that is going to help them in a long term and really put the jaw in a better position, relax the muscle, relax the spine, and take away from their headache. And at that point, we can transfer that position of the correct position of the lower jaw to their teeth, and for a long term, they can go on without having any problem or issue. So if the TMJ goes untreated, it can cause sleep apnea, it can cause tension headache, it can cause migraine, it can cause headache and shoulder pain and spine pain, it can cause sciatic. So those are, or also they're basically the breathing posture of the patient. As far as the TMJ goes, most of these problems, the signs and symptoms, we see them in our young patients. Unfortunately, since we are young, all of these signs and symptoms are masked, and we don't really have the knowledge and understanding as a young people to how to fix this stuff. My goal is really to educate those young people and make sure they understand what trajectory they're going with if they don't fix the problem when they are young. So what are they really expecting of their life longevity or their physical health? When we have the wrong position of the mandible, that will eventually cause the TMJ. When we do sleep, when the mandible goes in the posterior position, we are going to prevent the fluid that goes around the head to get all the toxic out. Basically, the recovery of the brain that happens the last 2 hours of our sleep from 6 to 8, that basically is not going to happen. Every time we have a sleep apnea, we have hypoxia or apoxia. Basically, what they mean, we stop breathing, and that lack of oxygen is going to wake us up. So we are not in the REM sleep, we are not in the deep sleep, and that will cause the body not to recover. And when we wake up, our body is tired, our brain is foggy, and doesn't matter how many hours of sleep we get, we are still tired. So most of our patients don't understand the jaw and the teeth are really directly correlated with their health and how they can get up in the morning and go on with their life, what they can accomplish, what type of a productivity they can bring to the society. So us as a dentist, our job is to really educate our patient. My goal specifically is to educate every single patient of what they can really achieve, what is their optimal and their potential of achievement of their health, and with that they can really grow and flourish in the society. If you have TMJ problem such as pain and clicking in the joint, ringing in the ear, I would like to invite you guys to come and see me at Center for Dental Implant in Aventura. I would love to educate you guys and find the best solution for the TMJ problem that you have.